Social anxiety disorder is often referred to as the disorder of lost opportunity because it essentially makes people not achieve their full potentials. And when you think about it, that's a pretty terrible thing. But if it is well managed, then people can achieve wonderful things. And so that's why I'm making this video, to educate people about social anxiety disorder and possibly to lead you in the right direction in how to manage it for yourself or for someone you know. In this video, we're going to first talk about the diagnosis and the symptoms of social anxiety disorder using the DSM, the Diagnostic and Statistical Manual, which is what psychiatrists use to diagnose mental health disorders. Then we're going to talk a little bit about the cause of social anxiety disorder. And then finally, I'm going to answer some of the common questions I've gotten from you guys about social anxiety disorder. Now, before we begin, I'll just introduce myself. I'm Dr. Sil. I'm a junior doctor working in Sydney, Australia, and in my free time, I enjoy making YouTube videos to educate and empower people about medicine, mental health, and all sorts of things. If you like this kind of content, you can consider subscribing or signing up to my Patreon. Otherwise, let's get into the video. So in terms of the diagnosis of social anxiety disorder, it's best to follow the DSM, the Diagnostic and Statistical Manual version 5, the most recent one. I've got it up here on my iPad, and just reading through the 10 or so criteria that are required for the diagnosis, I'm noting that it's quite dense and probably a little bit boring to read through. So I think I'll just talk about the key points. And the key point is that social anxiety disorder is this distinct and significant fear and anxiety associated with being in social situations where the anxiety is based off fear of other people judging you. Okay, that it's the fear of being judged externally from other people. And often this fear is because they're worried that they will do something that other people will interpret as embarrassing or negative in any sort of way. Often people with social anxiety disorders are really stressed that they might be looking stressed, and anxious that they might be looking anxious, and displaying like features of anxiety, like even physical features like blushing. And it can be any social situation. It can be from standing in the queue at the coffee shop to delivering speeches or giving presentations and that kind of thing. And in fact, if it's just one specific situation that triggers it, and the specific situation is performance, like playing piano on stage or giving speeches, you can actually be subclassified as performance subtype social anxiety disorder. But realizing that it's specifically social situations with other people, usually strangers, that judge you negatively is a really important thing to appreciate, because that's how it is distinguished from other anxiety disorders like generalized anxiety disorder or agoraphobia. I mean, this is a long-term disorder. This is not just a brief, tough 2 weeks. This is 6 months plus of symptoms. So you experience the symptoms for 6+ months. And the second thing is that these symptoms are significant. They are impairing your function and your relationships with your friends, families, kids, bosses, colleagues, whatever. It's functionally impacting you to a point where you are missing out on your potential. You're not going for, specific promotions because you might be embarrassed because they involve giving presentations or something like that. So it needs to be like 6 months at least, and it has to be significant impact. So that's also a way to distinguish it from shyness. Like, being shy is not a disorder. It's only when shyness gets to its extremes that you would have something called social anxiety disorder. Now, an important thing to consider right now is that you cannot make a diagnosis of social anxiety disorder based off watching a YouTube video by some random Sydney doctor or anyone else. You have to go to a psychiatrist or a mental health professional to get a diagnosis of anything, because this is just general education, but your story might be specific and nuanced. It is specific and nuanced, and it's not as simple as just watching a video and getting a diagnosis. Nothing in psychiatry is that simple. Now, if you want to read through all the other specifiers, I'll just copy paste them into a pinned comment below. Now, when we reflect on those diagnostic criteria, I think a couple of points aren't specifically made in the DSM, and that is, for example, that this anxiety is often ego dystonic. So the people who suffer from the anxiety often understand that it's irrational and understand that people probably don't think negatively of them, but it's just ingrained in this intrinsic response to social kind of situations, and it's kind of like it's part of just their response. It's not something they get to choose. You don't get to choose if you jump in fright if a friend scares you, right? It's an instinctive response, and it's the same thing for someone with an ego dystonic social anxiety disorder. That's just something that they experience almost naturally. All right, I feel like we've talked a lot about the symptoms and the diagnosis. Now let's talk a little bit about what causes social anxiety disorder. Look, like with a lot of things in mental health medicine and psychiatry, we don't fully understand the cause of social anxiety disorder. We know that there are genetic and environmental components, like the bio and the psychosocial social components. The genetic components, are probably a stronger predictor of if someone will develop social anxiety disorder. So if you have a first degree relative, like a brother or a sister with social anxiety disorder, you are 2 to 6 times more likely to get the disorder than a random person in the population. But there are also environmental things that can trigger it or increase your risk of developing it. Things like being abused or experiencing neglect in your childhood. These things can increase it. But yeah, the fundamental causes aren't fully understood, but we know that the average age of onset is usually in the early teen years, around 13 years old. Now, let's talk about the treatment of social anxiety disorder. It is not easy, but it is effective, okay? So hear that out. We've already talked about how this is a long-term disorder. It is a marathon, not a sprint. Unfortunately, that is the same with the therapy. There is no one pill that you can take that you are magically Mr. You can go out into social situations and talk to everyone and give presentations. There's no pill that will do that. Well, I don't know, maybe ecstasy or something, but you shouldn't try that. That won't work at all. It's probably a very dangerous idea. I shouldn't have even talked about that. But it does link to an important point we're going to talk about later. Anyway, there is no one medicine that will fix social anxiety disorder perfectly. You have to work at it. And what I'm leading to with this is that you have to do cognitive behavioral therapy, so therapy, psychotherapy, and probably take some medications to support you whilst you do that. Now, cognitive behavioral therapy is kind of like thought challenging. So you identify the thoughts that you get, then you challenge them, and you change your behaviors in response to certain thoughts. And it takes a long time, and you need a really good therapist. And it doesn't take that long, but you want to take at least 10 sessions with a therapist, and you're trying to achieve goals like exposing yourself to a social situation, and you work out these goals with your therapist. But find yourself a good therapist, because that's really important. Now, you may also need medicines to help with the symptoms of social anxiety. It's known that selective serotonin reuptake inhibitors, the SSRIs, the antidepressants, fluoxetine or paroxetine, these can help with the symptoms of social anxiety disorder. Sometimes people are prescribed benzodiazepines, which are anxiolytic or anti-anxiety medications, which help reduce the symptoms of panic that some people might experience in social situations. And finally, some people are offered beta blockers, which block adrenoreceptors, which are the adrenaline receptors, so that essentially it mutes your fight or flight response so that your heart doesn't beat really quickly, it slows it down. So these are similar medicines that are used in other anxiety disorders as well. But the key is to use the therapy and the medicines together so that you can get yourself to a space where you can basically achieve your goals. All right, let's close with a bit of a Q&A. I got some questions here from you guys about social anxiety disorder, and let's go through them. First question is, what's the difference between shyness and social anxiety disorder? Look, the way that I like to think about it is that shyness is a normal character trait, but when it becomes extreme to the point where people cannot achieve things that they want to achieve, that's when it starts to be in the realm of social anxiety disorder. Okay, so do not pathologize just being shy, especially with kids being shy. That's very normal in a kid's development, but it's when someone has a goal that they want to do something, but they just can't because of how socially anxious they get. That's when it starts to verge into the territory of a disorder. Next question is, I want to date, but I have social anxiety disorder. What are your tips? Okay, look, I actually think this is where online dating is extremely effective, because you can have the exposure in a safe way to someone you might want to go on a date with, and you can kind of get a pretty good understanding of who they really are, and kind of take down the barriers to see if they're a judgmental or non-judgmental person, to see if they will judge you for your social anxiety or not. Yeah, that's a kind of nice aspect of online dating. There's no shame in online dating, by the way. Next question, how can I support my spouse in social situations? She has social anxiety disorder. I think first things first, have realistic expectations, right? There's nothing you can do that'll just make your spouse come out and he or she just be super social and super whatever. You need to have realistic expectations. Just support them. Don't ditch them. Don't just leave them alone for the whole night and do your own thing. Be involved, talk in groups, involve them in the conversation. And if they're if they're leading the conversation by themselves, you can just step back. You don't have to babysit, and just talk about how it went for them afterwards and what you can do differently. It's always going to be specific to the person. And the final question is about essentially comorbidities and misdiagnoses. So yes, this is probably one of the most important points of social anxiety disorder. That it is often co-diagnosed with substance abuse disorders because people self-medicate with drugs and alcohol to become more social, and that can be really dangerous. And so usually you have to address both of the issues, the social anxiety disorder and the drug and alcohol disorder, and sometimes addressing one will help with the other. Now, it can also be misdiagnosed as agoraphobia, which is really the fear of getting trapped in social situations. It's not really fear of being judged, it's fear of being trapped. There's also panic disorder. Because you can get panic attacks with social anxiety disorder, it can often be murky which one's which, but with panic disorder, you're getting panic attacks because you're scared of getting panic attacks, not because you're worried of people judging you. And with social anxiety disorder, it's really about being judged that triggers the panic attack. Often with social anxiety disorder, you can kind of predict what will trigger a panic attack. With panic attack disorder, it's really hard to predict when you'll get a panic attack. It can happen anywhere at any time. And generalized anxiety disorder is also sometimes misdiagnosed. The key thing here is that generalized anxiety disorder is general. Lots of things will cause you anxiety, whereas social anxiety disorder is specific. There are specific social situations, waiting in a line, giving a presentation, specific things that trigger the anxiety. All right, guys, that is it for this video. Thank you for watching. I hope you found it interesting. If you'd like to support the channel, you can subscribe. You can leave the video a like. That'll help it grow. You can even consider joining me on Patreon. And the first 25 people on Patreon, I get to do a meet and greet call with, and there'll be there'll be live streams and things as well on Patreon. So that's exciting. But yeah, that's it for this video. And I wish you all an absolutely lovely day. All right, I'll see you in the next one. Bye for now.